मॅडम सुगंध तर इतलो बरो येता जाणा.
थँक्यू.
टिफिना वांगडा त्यो न्यूट्रिशनाच्यो गुडयो दिवपाक विसरू नाका हा.
आता तू न्यूट्रिशनाच्यो गुळयो विसर.
कित्याक?
का या तांदळातूच सगळे न्यूट्रिशन मेळटले. पंचामृता फोर्टिफाईड राईस हातूंत आयर्न, झिंक, फॉलिक ऍसिड, व्हिटॅमिन ए, बी सारकेले 9 मिनरल्स आसात. तर हे झाले नाही निरोगी आणि सुवादिक. तर पुराय पौष्टिक आहारा खातीर
पंचामृता फोर्टिफाईड राईस
असल्यास पुरो.
पुराय पोषणा खातीर पंचामृता फोर्टिफाईड राईस. घराघरांनी पंचामृता.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कारण तुमकां सगळ्यांक मना काळजावसान येवकार. तुमकां येवकार दितनाच आज आमचे जे एक्सपर्ट आसात ते आसा डॉक्टर दिनेश MG, सिनियर कन्सल्टंट रोबोटिक अँड मिनिमल इन्वेसिव्ह सर्जरी फ्रॉम हेल्थ केअर ग्लोबल बेंगलोर. एक तज्ञ आणि एक्सपर्ट असो मनीस जो आमकां खरें म्हणजे बऱ्याच म्हणजे कश्टांनी मेळ्ळा अशें म्हणूं येता. कारण तांचे जो आजचो विशय आसा तो आसा रोबोटिक सर्जरी इन कॅन्सर मॅनेजमेंट. रोबोटिक सर्जरी म्हाका दिसता आख्खे इंडियेनूच म्हाका दिसता कराची एक 10-15 जाग्यार हे करता आसतले आणि तातूंतल्यान एक म्हणजे तांचें हॉस्पिटल. तर हे रोबोटिक सर्जरी म्हणजे कितें, ते कशा रितीन काम करता आणि कॅन्सर हे अशें दुयेंस आसा स्पेशली गोंया खातीर आमी खूब वरीड आसा. कारण आमचे जे कॅन्सरचें प्रमाण आसा तातूंत एक ब्रेस्ट कॅन्सर आसा, कोलोन कॅन्सर आसा, हांचें प्रमाण खूपच वाडत आसा. अशा वेळा ही पुराय जाणविकाय दवरप, पुराय माहिती दवरप, लोकां मदीं एक अवेरनेस निर्माण करप आणि ह्या झुजान आमी सगळे वांटेकरी जावन एकठांयपणान ह्या झुजा आड आमी ह्या लढायेर आमी वांटे घेवप आणि ती जैतिवंत करप ही आमची मोख आसा. त्या खातीर डॉक्टर वेलकम, नमस्कार. First of all, when we talk about cancer and cancer management, let's talk in brief on what you mean by cancer.
Sir, cancer means abnormal cells.
Correct.
Which grow abnormally, like uncontrollably.
Yeah.
And they not only grow in that area, they spread through blood or through lymphatics to other organs also.
Yeah.
What we call it as metastasis. So that is why cancer is as involved so many treatments.
Yeah.
Not only like surgery, which is my field.
Correct.
Which is like chemotherapy, radiotherapy, all that. Not only to control locally, also to control systemically.
Yeah.
Through blood also we need to give treatment.
So it is initially it happens, it can occur in one place at one organ, but it can gradually include in other
Yes,
places.
yes,
As you said rightly, it get metastasized.
Yes, sir.
So it spreads. So
Yes, sir.
our full war is against all this spreading also.
Yes, sir. Yes,
as well as to confine and take the organ which is already affected to be out of the body so that it doesn't spread.
Yes, sir.
Doctor, now since as you rightly mentioned, the trends are changing. Now initially we had chemotherapy, we had so many other things. Now there is surgical intervention also, and in surgery also there are a lot of newer interventions are coming. So in this role, when we talk about what is the role of surgery in cancer management, because when we are talking about, we often feel nahi aisa bhi to spread hone wala hai, so what we are going to what are advantage, but still surgery plays a key role. So I want you to talk about surgery and what is the role in management of cancer specifically.
So surgery has a major role in curing cancer, especially in curing cancer. So mainly for curable cancers, when they come very early, we do surgery upfront. So we do initially surgery, then give chemotherapy, radiotherapy, whatever. So few cancers, if they come little bit late in advanced stages, we do give chemotherapy or radiotherapy before surgery and try to, like you told, we try to confine it to the organ, try to minimize it, try to downstage it.
Achha.
So try to get it to the earlier stage and then operate, so that we can give better results. So now new modalities have come where we give neoadjuvant chemotherapy or neoadjuvant radiotherapy, with which we confine it to that organ, and we also make sure that it is downstage, the size is decreased, then it's easier for us to do surgery. And like you told, surgery has a major role in curing cancers. In more than 50% of cancers we do surgery, where we try to cure patients. And also in palliative cases also we do surgeries where there is obstruction of any bowel. So if there is, even in breast cancers, when there is lot of, even though it is spread, when we have to do a toilet mastectomy, that means if they have fistulas, if there is pus pouring out, or if the tumor is pouring out of the breast, so we have to do a toilet mastectomy because for the patient it will be healthier to keep that area clean. So we have to do palliative surgeries also other than curative surgery.
Acha. So surgery is not just curative, it has also palliative,
Palliative
also.
also.
And as you rightly said, or as the topic is there, and let's talk something about, see, now the trends are changing. And when we talk about changing trends, see, once upon a time we used to always feel that bigger the surgeon, bigger is the incision. So we used to say, अरे मेरा वो क्या इसका ऑपरेशन किया 20 कोलेसिस्टेक्टोमी किया तो मुझे 20 स्टिचेस लगाए 20 लगाए 15 लगाए, and then we said अरे हाँ 15 लगाए, miss we used to talk. But now trends are changing. Smaller the incision, bigger is the surgeon.
Yes.
And in this field, when we are talking about robotic surgery, where this robotic surgery comes into, when we are talking about this big surgeon and small surgeon, or a small incision, big surgeon, or a big surgeon and big surgeon?
Sir, every surgeon is a big surgeon for me. But nowadays, like you told, the trends are changing. Earlier, it was all, cancer surgeries were always big surgeries.
Correct.
It is not like an appendicectomy or a cholecystectomy. Correct. We do a lot of lymph node dissections also other than this.
Absolutely.
Even if it is an appendix cancer or a gallbladder cancer. So it's a bigger surgery. Obviously, we need bigger incisions.
Correct.
So earlier it was like that. Now we have got laparoscopy in each and every hospital. Yeah. But robotic machines are little bit more expensive and not everybody has it. So fortunately we have 2 robots in HCG. In Bangalore we have 2 robots. So we do a lot of robotic surgeries. So the advantage in smaller incisions is the recovery is faster, sir.
Achha.
So the morbidity is very less, the blood loss is very less because the field has to be clean for us to do surgeries through the small holes. It has to be clean, so we can see even very small vessels where we coagulate and cut, so that the blood loss is very less. It's very good for the patient. And also the recovery is very fast. Patient can go home very fast. So even if you do a colon cancer surgeries, so when I do a open surgery, we call it as paralytic ileus. With the recovery of the bowel also for the movements to come, it will take little bit more than 3-4 days. If I do a robotic surgery or laparoscopic surgery, in 1 or 2 days we get back the bowel movements and all. So everywhere, in all aspects, the recovery is faster in laparoscopic surgery. So patient can go home, and obviously the scar, the aesthetic look also is there where they don't have a bigger scar. All these advantages are there.
Okay. Now, since you mentioned about this lymphatics, I'm just asking out of curiosity or academic twist, I can say. See, sometimes now you have already diagnosed a case of cancer of any organ, and suppose there are, since when you are going through a keyhole surgery, are you accessible to all those lymph nodes and all the things which are around, or is it difficult for you?
Yes, sir. That's a nice question. Actually, oncologically, we tell that whether it's an open surgery or a laparoscopic surgery, we can't compromise on the field of surgery.
Correct.
We have to take out the extent whatever we have mentioned, oncological aspects, whatever we call. So the entire organ with the lymphatics, with the regional lymph nodes, we have to take it out, whether it's open, robotic, whichever is easier for the surgeon. That's why I told every surgeon is big.
Yeah,
so
correct.
if you are comfortable with open surgery, we have to take out all that. So if you newer surgeons, they are comfortable with laparoscopy and robotic surgery, so that entire organ with the lymphatic channels, whatever the lymph nodes, the regional lymph nodes has to be taken out. So there can't be any compromise on that. Then only it will be an apt surgery. So even in robotic surgery, all the lymph nodes, whichever is accessible through open surgeries, all that is done. And also, in fact, it is easier in like pelvic surgeries and in thoracic surgeries where the lymph node yield maybe the sphincter preservation, the organ preservation, all these things can be better in a laparoscopy or a robotic surgery than open, I feel. That's what I feel.
Okay. Now I'm coming to a very targeted question, like you have targeted therapy.
Yes, sir. Yes.
So my question is, now since you have mentioned about open surgery, laparoscopic surgery, and also gave a brief address about the robotic surgery. Now, first of all, you just try to explain us what you mean by robotic surgery, because people are under the impression the machine is going to operate you. If machine is going to operate you, how the machine is going to have, is it all artificial intelligence dependent, or the intelligence is there sitting behind the machine? And what is the advantage of robotic surgery? You have mentioned actually, but still in a little elaborate way, because people sometimes feel, अरे वो machine है क्या कुछ गड़बड़ भी कर सकता है. So that is also can happen. How it is advantage? If at all it is advantage, then in which field it is advantageous? Actually, you have mentioned just now, but I would like to have a little more clarification on this.
So like you truly told, many patients have come and asked for robotic surgery, they don't mind who is the surgeon. They want a robot to operate.
Correct.
So there are people who come and ask that, and there are people who don't want robotic surgery, like you told, because they think that the surgeon is not right next to the patient.
Correct.
So if the machine is operating, we don't want the machine to operate, we want the surgeon to operate.
Absolutely.
So this has also come recently. I had a rectal cancer patient where his sister was a nurse, and somehow she has told him that the surgeon won't be there, Dr. Dinesh is not there in the room, so it is the machine doing. If something happens, he is not there. So he was not willing. But it was a very low rectal cancer where we had lot of advantage in doing a robotic surgery. I had to convince him a lot. Finally, I did it, and we had to preserve his sphincter. It was like around 3 centimeters lesion from the anal verge, where it's better we use robo, and we can give a good margin distally in the rectum. So we did a good job. So like you told, both sides are there. But to tell you frankly, laparoscopic surgery is a little bit strenuous for the it will more strain on the surgeon, because we will have to stand right in front of the patient, over the patient, and operate for few hours. So our surgeries, oncology surgeries, especially through laparoscopy or robotic, it takes more than 5 hours, sometimes 5, 6 hours, 8 hours and all. So standing for such a long time, it's very strenuous for us. But laparoscopy also we can do a good work. In robotic surgery, it's the same arms that is fixed to the robotic arm, the same instruments, almost the same instruments, where it is fixed to the robotic arm, and I can control it through a console where I'll be sitting maybe around 1 or 2 meters away from the patient, wherever. But I'll be in the operating room, but I'll be sitting little bit away from the patient, and my assistant will be there to assist me in case of any emergency, but I'll be operating from little bit distance, the same operating room. So it's very easy for me. I'll sit. It will be a 3D vision, and the controlling the controlling arms inside the body, inside the patient's body. If it is laparoscopic surgery, the arms move in only 1 or 2 directions. So it will be the straight arms. But here in robotic, the end of the arm, it will be like a wrist. Like a wrist, it rotates more than a wrist. It rotates. It rotates in 270 degrees.
Achha.
So I get better control. So there is no tremors also just transmitted. So in laparoscopy, the tremors are also transmitted. Here there are no tremors, 0 tremors, and the control is so much better, and the precision is very good. And also because of 3D, so that depth perception, everything is very good. So the clarity is very good. So we can do better surgeries. The blood supply, like I told, every small blood supply we can see and we can control it. So it's almost a bloodless field in robotic surgery. Lot of advantage for the patient, and lot of advantage for the surgeon also.
I see. Plus, it is a very skilled job also. You
Yes,
require,
sir.
I think there are hardly few surgeons,
Very
who
few
is,
surgeons for
in
doing
India at
robotics.
least,
Yes.
because it's upcoming field. अँड म्हणजे आता ॲक्च्युली उलयता आमी एक अशा विशया कडेन की रोबोटिक सर्जरी म्हणजे रोबोट इज बेसिकली लायक अ मशीन, पण ते मशिनाक फक्त इट डजंट वर्क ऑन आर्टिफिशियल इंटेलिजन्स एज वी परहॅप्स थिंक, पण त्या रोबोटा बरोबर एक सर्जन असता जो सगळे ताचे मेकॅनिझम सगळे ताचे मुवमेंट्स कंट्रोल करता. आणि ताचा एक एडवांटेज अशें डॉक्टरान सांगला की ते मशीन ते सगळ्या डिग्री म्हणजे 270 डिग्रीज ते मुवमेंट्स करू शकता, म्हणजे जसं आमचा हात सुद्धा करू शकना इतकी फ्लेक्सिबिलिटी तातून असता. वेरेज जेन्ना आमी की होल सर्जरी किंवा आमी लेप्रोस्कोपिक सर्जरी म्हणटा हातून ते सगळे मोमेंट्स तितके इजिली पॉसिबल जायना. इट इज मोर टायरिंग अँड इट मे बी नॉट एक्सेसिबल. वेरेज रोबोटिक सर्जरी हॅज ऑल दीस एडवांटेजीस. सो तो सगळ्या दिशेने घुवू शकता, सगळ्या पद्दतीने घुवू शकता. ताका मॅग्निफिकेशन असता, ताका 3 डायमेन्शनल इफेक्ट येता. सो हें सगळें करतना एखादें ल्हानसो ब्लिडर म्हणजे सादी रक्ताची वाहिनी जर खंय आसा तुटल्या कितें जाला तेकाय मॅनेज करू शकता. ह्या सगळ्या गोश्टींतल्यान जेन्ना पळयता तेन्ना पेशंटाची रिकवरी फास्टर जाता, पेशंट बेगीन बरो जाता. आणि ह्यो सगळ्यो फॅसिलिटी ज्यो आसा म्हणजे एक मदीं सांगपाचो म्हत्वाचो मुद्दो हो आसा की आज गोंय सरकाराची जी आमची योजना आसा DDSY दीनदयाळ स्वास्थ्य योजना, तसेच मेडिक्लेम आसा, हातून ह्या हॉस्पिटलाच्यो फॅसिलिटी सगळ्यो कवर जाल्ल्यो आसात. म्हणजे जेन्ना एखादे दुयेंस अशें जातात जेन्ना आमकां दिसता की आतां सगळें आतां आपल्या कडेन काय उपाय उरूं ना, कॅन्सर जाला, अशा वेळार सुद्दां हे नवी टॅक्नॉलॉजी, नवे मॉडेलिटीज ऑफ मॅनेजमेंट, इनफॅक्ट आय से म्हणजे म्हाका खूब बरें दिसता की गोंय सरकारान हातून इनिशिएटीव घेवन ही खूब तरेची फॅसिलिटी आज उपलब्ध करून दिल्या. आनी ताच्या खातीर बरेचशे हॉस्पिटल जे आसा तांचे कडेन असोसिएशन आसा, तांचे अफिलिएशन आसा, आनी जी गोंयांत उपलब्ध ना फॅसिलिटी ती सुद्दां सरकारान गोंया भायर वचून उपलब्ध करून दिला. आनी ह्या खातीर गोंय सरकारचें तशें गोंयची जी भलायकी यंत्रणा आसा ताचे सगळ्या गोंयकारांनी खदांच मना पासून आमी उपकारी आसात. कारण म्हाका दिसता आख्या देशान अशी फॅसिलिटी खंयच ना. सो आय थिंक इन एंटायर इंडिया वी हॅव दीस फॅसिलिटी ऑफ DDSY वेर दीस, अँड फॉर्च्युनेटली युअर हॉस्पिटल इज बीन असोसिएटेड अँड वी आर अफिलिएटेड विथ इच अदर. So we are looking forward for such management of any cancer patient as and when required for robotic surgery and also associated surgery. Doctor, one more question I have. Since nowadays what we have observed in Goa, we have got breast surgery, breast cancer quite common and colon cancer common. In this situation, now since you are talking about robotic surgery, where is the role of robotic surgery in this both two types of cases, because of number is quite alarming and increasing. So that's why I want your expert opinion on this.
Sir, breast cancer, that is the maximum we have seen. So it's not only in Goa, it's throughout the world. That is like the number one incidence in cancer. So breast cancer has number one incidence, not only in Goa. So everywhere it is there. Colon cancer, like you told, maybe that's more here. So colon cancer, maybe because of some dietary variations, maybe they the quality
Red
of
meat
the,
and all
that what the difference is there in here in Goa, what they eat. Maybe because of that there might be there in some increased incidence. So, but for breast cancer nowadays they are doing robotic surgeries, but it's a very superficial organ. So where we might not need, it might be accessible very easily, especially in very few cases like nipple sparing mastectomy, where we have to preserve the skin and lot of skin from the breast and even the nipple, where we don't have much space to take out the entire breast. So sparing all the skin to do a reconstruction further. So such cases we might use robotic surgeries in breast. Very few we get something like that. But in colon cancers, whether it is right colon, left colon, or sigmoid colon, or upper rectum or middle rectum, anywhere in the rectum, so they have a lot of advantages in laparoscopy and robotic surgeries. Obviously we have a lot of advantage in rectal cancers, where in the pelvis the accessibility is very less, like you told. Because of robo we have more and more access. The lymph node yield is better. We can go to a proper plane even after radiation in the rectum. We can go to a very good plane, where in robo it easily opens up for us during surgery. For a surgeon to operate, what else we want? We want very good planes. So all that is very nicely appreciated in robotic surgery, because the plane, because of 3D imaging and the clarity, it is very nicely seen. So obviously colon cancer and colorectal cancers, we have a huge advantage with robotic surgeries. And since there is increasing incidence in Goa, so they will have a lot of advantage. And especially in HCG Bangalore, since we have got a tie-up with this DDSY and Mediclaim, all the patients can utilize this and services, and we have two robo system in our HCG Bangalore, so they can utilize the services and we can do a good jobs.
सो बेसिकली डॉक्टर आमकां सांगला की हे खूब महत्वाची गजाल आसा की आज जेन्ना नवीन तंत्रज्ञान येता ह्या फिल्डान, म्हणजे मेडिकल मॅनेजमेंट कॅन्सराचे स्पेशली, जाल्यार हे नवे तंत्रज्ञान आसा ताची गोंय सरकारा कडेन तांचे अफिलिएशन आसा, तांची एक संयुक्त असो करार आसा. त्या खातीर ह्यो सगळ्यो फॅसिलिटीज आज गोंयच्या खंयच्याय मनशाक जेन्ना एका कॅन्सर सर्जरी लागतली कॅन्सरा खातीर, स्पेशली ताणें एक सांगला की रेक्टल म्हणजे आतकट्यांचो जो कॅन्सर आसा ताच्या खातीर जे एक्सेसिबिलिटी इतकी इजी आसना, कारण थंय सगळ्योच आतकट्यो आसता, ल्हान आतकट्यो आसता, व्हडले आसता, आनी तांचे अटॅचमेंट आसता, ते एकमेकाक तेकिल्ले आसता, थंय तांचे लिम्फ नोड्स आसता. अशा वेळार रोबोटिक सर्जरी आनी मिनिमल इन्सिजन सर्जरी जी आसा ती खूब हेल्पफूल आसा. ताचो बऱ्याच अंशी फायदो जाता आनी म्हणजे कितें आसता, पेशंट बऱ्या बेगीन बरो जाता. ताचे बावल मुवमेंट्स म्हणजे ताचे जे सगळे बाकीचे सगळे रुटीन क्रिया आसा त्यो बेगीन टेकअप करूं शकता. आनी हाचो फायदो आज सगळ्या लोकांक पर्यंत पावूं शकता. आनी हें सगळें समजून सांगतना डॉक्टर आमकां बरेच म्हत्वाची मोलादीक म्हायती दिल्या. Doctor, one more thing I just want to ask you. Can it happen like suppose you are already started with robotic surgery, because sometimes it happens with laparoscopy surgery. We start with laparoscopy surgery and then we have some accessibility problem and then we have to go for open. Does it happen that much frequently in your robotic surgery, or usually it doesn't happen? I'm just asking out of curiosity, I'm asking.
No sir, usually it doesn't happen because we'll plan the surgery properly. We ourselves we know how to read the imaging. So we would have done a proper imaging and we know whether it is operable or inoperable. If and all, if a previous surgery is done and if there are a lot of adhesion, sometimes very rarely we might have to open. But very rare sir, I have not opened up for any surgeries as such.
So practically we can say it is nil.
Yeah, yes sir, almost nil. Yeah. If there is any difficulty, obviously the gold, I mean, surgeon is always comfortable with a open surgery, and any bleeding, any emergency, we will have to open and we will have to stop the bleeding then and there, and it's easier in open surgeries to do that. So obviously my assistant is always there and I am also right next to the patient. within few minutes we'll open and we can access
So
it.
if at all,
Yes,
it is
sir.
like an emergency exit.
Yes, yes.
So which doesn't happen usually.
Yes,
so
it
it's
doesn't
like a fire
happen.
exit.
It doesn't happen.
Okay. Now one more thing, since we are talking, since I belong to gynec department, my question is very simple. What is the role of your robotic surgery in CA related to gynec patients?
Sir, in gynec cancers, what usually CA ovary, they come up with a huge cyst, ovarian cyst, where we'll have to open. We can't rupture the ovarian cyst. You know that. So we have to take out the ovary with the cyst and send it for frozen section, where they tell that it is cancerous or not. So after that, anyway, it's an open abdomen. So accessing the other parts of abdomen is very easy in open. So we continue with lymph node dissection and omentectomy in ovarian cancers. So, but in endometrial cancers, where it is very limited, they come very early, and even in CS cervix, very early disease only we do operate. So they come pretty early in ovarian and in cervix and endometrium. We can do a good radical hysterectomies in robotic surgeries, and the advantage with laparoscopy and robotic surgeries in gynec-onco is it has more advantage than GI and all, where all the lymph node, whether the omentum, the lymph node, the whole specimen will come out through the vaginal vault, and there is no incision on the body at all. Other organs we have to put a small incision to take out the tumor out. Here everything comes out through the vagina, so there is no incision other than the laparoscopy or a robotic port incision.
सो इन शॉर्ट हांव सांगता की डॉक्टरान जसं सांगला की जे गायनेक आणि बायलांची जी सर्जरी आसता म्हणजे आमकां CA ताणें जे सांगले होता ते हाचो खूब फायदो जावं शकता ताका पोटार खंय चिरफाड करची पडना सादो पंक्चर करचो पडना आनी हाचो फायदो पेशंटाक जाता तो बऱ्या तरेन बरोय जावं शकता डॉक्टर वेन वी टॉक अबाउट ऑल दीस सर्जरीज एंड एवरीथिंग नॅचरली बिकॉज नाव डेज वी टॉक अबाउट कॅन्सर एज अ लायफस्टायल डिजीज सो वेन वी टॉक अबाउट लायफस्टायल डिजीज द फर्स्ट थिंग वॉट कम्स टू माय माइंड एटलीस्ट इज हाऊ वी कॅन प्रिव्हेंट इट before it is advanced, and because often means my personal observation is that it doesn't pain, and whatever doesn't pain, people always are reluctant to go to doctor. Whether it is breast cancer or they say no, it doesn't pain. So then they correct, nahi, मैं बचपन में एक बार गिरी थी, ये हुआ था. So these type of things are very harmful. So I want it should come from the horse's mouth. So what you say, people are watching. Yeah.
Sir, now like you told, whether it is a breast tumor, when it is not painful, they don't want to come because it is not causing any harm. But slowly the tumor is growing and it is slowly spreading out. So people should know that painless tumors, painless swellings are more dangerous than painful swellings, because painful swellings are more of inflammatory swellings.
Correct.
Where people will go, they will take some painkiller, it will easily reduce.
Correct.
The painless tumors are always very dangerous. And when a patient has a tumor or a swelling or any other symptom like a bleeding PR or vomiting sensation, anything, obviously they will go to a general practitioner who is close by. So he gives some medicines. So if it is not getting solved in another 15 days, so any medicine, it has to come down.
Correct.
If it is not coming down within 15 days or 10-15 days, obviously they will have to subject themselves to a higher diagnostic modalities like CT scan or anything. So obviously they will have to go to a bigger center. Once that is done, we obviously with endoscopies or CT scans, we will know what it is, whether it is a bad tumor or a good tumor, a benign tumor. Or whatever. Once that is known, if it is a cancerous tumor, obviously they would have come early because they would have noticed early, and obviously we can do a surgery as early as possible because it is an early stage, and surgery can be the first treatment. So they will have to come to a bigger centers, not confine themselves to a
where all the facilities are available under one roof.
Yes, sir. So they will have to come to bigger centers where other modalities are available. So they should not neglect it when there is a symptom and it is not coming down with symptoms. So that is one thing, sir.
Yeah. So one more, doctor, I have got one more question. Since you mentioned about this colorectal surgeries and all this related to your robotic surgery, so what I mean to say that my question is, what are the signs and symptoms usually patient come with in this colon cancer or GI related cancers?
So GI related cancers, if it is upper GI, it will be more of vomiting sensation. If it is in the esophagus, it will be more of dysphagia to solids initially. So they will be having difficulty to swallow food. So anything in the upper aerodigestive tract, they will have voice change or they will have difficulty in swallowing. So when it comes to stomach, obviously they will have this nauseating feeling, early satiety. They have little bit food, so they feel that they are already full. So because the volume is less there, or little bit later they might have vomiting sensation. So all these are the symptoms of upper GI tract. So coming to lower GI tract, on the right colon, so they will have symptoms like anemia initially. On the left colon, they will have anemia means, or for the right colon, the blood, because of blood loss, there will be the hemoglobin would have come down. So that is also a major symptom for right colon cancer. So, and on the left colon, it will be more of obstructive symptoms. There will be, once a tumor grows, it will start obstructing, and patient will have bloating sensation. They will be having more and more loose stools, and maybe bleeding through stools, and vomiting sensation or bloating of abdomen. All these symptoms they will have with lower GI tracts.
सो डॉक्टर आमकां सांगला जे आंगार दुखता ते खंयचेच दुयेंस आंगार काडूं नाका. जर तुमकां खंयच्याय पार्टांतल्यान रगत वता म्हणजे तोंडांतल्यान वचूं किंवा संडासांतल्यान वचून लगवेंतल्यान वचून बेगोबेग दोतोराचो सल्लो घेयात. दोतोरा कडेन योग्य पद्दतीन मॅनेज करून पळयात. आनी समजा बाय चान्स कितें तुमकां दिसता की हें हातून कंट्रोल जायना जाल्यार गो टू बेटर सेंटर वेर ऑल द फॅसिलिटीज अवेलेबल. म्हाका दिसता ही खूब मोलाची माहिती आशिल्ली आनी हें सगळ्यां खातीर आमच्या खातीर म्हत्वाची आसा. हें एट द कोर ऑफ आवर मायंड इट शूड ऑलवेज म्हणजे आमकां ही फॅसिलिटी आसा हें कळपाक जाय, कितें करपाक जाय हें कळपाक जाय. तशेंच दुसरें म्हणजे सगळ्यांचो ह्या भुमिकेन सगळ्यांचो रोल आसा. कारण आमी हें युद्ध जें आसा कॅन्सरच्या अगेन्स्ट हें सगळ्यांचें मेळून लढपाचें आसा. तेन्ना आपले सोयरे धायरे घरातले इश्ट मित्र कोणाय कशें केन्ना दुयेंस दिसता तेन्ना गर्भगळीत जावनासतना तज्ञ दोतोराचो बेगोबेग सल्लो घेवप आनी ह्यो फॅसिलिटी ज्यो आज तंत्रगिन्यान आसा, नवे नवे किमोथेरपीक ड्रग आसा, हाचो फायदो करून सगळ्यांनी बरी जीण सगळ्यांक मेळची अशें आमकां तरी दिसता. आनी म्हाका दिसता ह्या सगळ्यांनी तुमचे सगळ्यांचीच म्हत्वाची भुमिका आसा. आनी अशें सांगून आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक देव बरें करूं. नमस्कार सर, थँक्यू वेरी मच. सर, थँक्यू.